So in covering deep massage in this demonstration, we're going to illustrate the principles as well as the techniques. And remember, deep massage is unique in that we're engaging both the structure and the energy. Remember, the subtitle of the book is How to Combine Structure and Energy in Body Work. And so I'm going to be combining clear demonstrations of how do you do each of these fulcrums, we call these techniques fulcrums, with showing how the principles behind deep massage are utilized within all the body work that we do. So I'm going to just highlight certain principles as I do this or technique or that. We'll also talk at some point about 7 dimensions of touch, which are kind of go along with body mechanics and psychomechanics of the therapist. How you can accentuate contact, movement, breath, manifest graceful verticality in your body as you work, how your heart is connected with your work, how your understanding is engaged, and how you're open to inspiration, open to transformation. So let's use fist down the erectors as an example, first example of fulcrum. So there's 7 steps to doing a fulcrum. The first step is to center yourself. And so I want to come undistracted. I want to be kind of in a more meditative state. And I also want to be physically centered so that my body mechanics are optimal. Second step is take out the looseness in the soft tissue. So I'm pressing in here until I feel the bones underlying her soft tissues here. The third step is take up the slack. Take up the slack, in this case, it's a moving fulcrum we're going to do, means stretch the tissue so you give the nervous system an indication of this is the way we're going to go. The fourth step is add additional vectors. In this case, we're going all the way down to either side of the spine, and we're adding additional vectors in that it's down, but also with a little side-to-side movement. Curves are essential because if you only move in straight lines, you're going to be communicating mechanically with the body. The body, the intelligence, the proprioceptors need curves in order to wake up as you're working. Straight lines just put the body to sleep. Curves show curiosity on my part. And so one of the things my additional vectors do is they manifest curiosity about where's the tension. Is there more on one side or the other? Is there more in the thorax? Is there more in the lumbar region, etc. And overall, what I'm doing here is taking out the looseness, take up the slack, add additional vectors, sustain the gesture. So this should feel like one long lengthening of the whole back. While you're sustaining the gesture or while you're holding a point, you're going to want to observe. Be in a witness state and observe, monitor for signs of relaxation, what we call working signs, the clients doing their own inner work. And then on the basis of your observation and your own sense of how long it should last, clearly disengage. Give the person a moment to integrate the experience for themselves. And between each of these steps of the fulcrum, there's kind of a micro pause. So let's just go over the kind of the how to do this, fist down the erectors. Take out the looseness, take up the slack. Add additional vectors coming down, introducing a curve, just gently, so the person feels your curiosity. And take this all the way down to about the level of S4, at least 2/3 of the way down the sacrum. Clearly disengage, and if you want, you can kind of do a return stroke such as we do in Swedish. A lot of times I'll kind of do a somewhat deeper effleurage with the heels of my hands down infraspinatus, up through the trapezius, neck, and just giving a little gentle traction at the occipital bone to add length and the feeling of length to the whole spine. The next thing we're going to do is work with the 3 main layers of the lower back, namely the erector spinae, the multifidus, and the quadratus lumborum. And these are going to be examples of direct pressure fulcrums. And so First thing I'm going to do is have my support hand across the body with my fingers almost at a 90-degree angle. I'm pulling toward myself and keeping the spine nice and aligned. With this hand, I'm going to start working into iliocostalis, the lateral most of the erector spinae, and just come on in, taking out the looseness, feel the tension in there if there is some, take up the slack, pressing in a little more deeply, and then hold it, hold it, hold it, and just sink in if there's a further opening for the person. Otherwise, again, as in all the fulcrums, by holding, you're giving them and their nervous system a chance to let go from inside out. Then I'm going to come up about halfway between the iliac crest and the 12th rib, just right through the middle of the lower back, and pressing into iliocostalis. My pressure is essentially medialward, so that is toward the spinous processes. Hold it, hold it, hold it. Hold that little fulcrum. And then take your hand, clearly disengage. Third point into the iliocostalis, just underneath the 12th rib. Take out the looseness, take up the slack. Sink in just a little. Again, it should feel very comforting and comfortable for your client. Hold it, hold it, hold it. And clearly disengage. My right hand stays pulling toward me, but my main interface is with this left hand into the lower back. Remember, my right hand is against the lower back muscles, not against the side of the body. So I'm clearly working with the same muscle group on both sides. Here, the second layer of this is multifidus. Taking out the looseness, take up the slack again, just over the iliac crest. The difference is when I start more laterally, I'm going to end up being in a deeper layer. Then I'm going to come into multifidus about halfway between the iliac crest and the 12th rib. I don't find much tension in that place, so I can move on, just gently moving on into multifidus just underneath the 12th rib, sinking in to the fulcrum. Hold it, hold it, hold it. Again, give them the gift of the time to let go from inside out. Third layer, quadratus lumborum. About a third of the way in toward the front of the body. Again, pressing medialward, above the iliac crest, into quadratus lumborum. Let this right hand be active. The body mechanics here is one of kind of letting your left hip come forward, so you shouldn't do this with tension in the shoulder girdle, but get it through just letting the left knee bend, come toward the table, and the left pelvis comes toward the table, and so that kind of pushes your left hand in and actually kind of pulls your right hand toward you, which is exactly what you want here. All right, so that's the third point in quadratus lumborum, just underneath the 12th rib. That's a nice thorough way to address the lower back. Remember the steps of the fulcrum: to center yourself, take out the looseness, take up the slack, add additional vectors, hold it, hold it, hold it, or sustain the gesture, monitor for change, and clearly disengage. Now, monitor for change means monitor for working signs. In my book, I go into lots and lots of different working signs, but let me just say that the two most obvious and helpful working signs are the person's breath and the person's face, particularly their eyes. When they're face down, you can't see the face, so you're really dependent on the breath. And so one thing I would look through at any point, but certainly with these strokes, is how is the person breathing? Is their breathing full? And sometimes when you do something particularly satisfying, do they take a larger breath than normal, like a sigh that indicates neurological completion? And so we talk about the third dimension of touch as being breath. Also, it applies to me as a therapist. If I am breathing fully, I'm giving the person permission, living permission, and I'm setting a therapeutic example for them to breathe fully in themselves, and I'm energizing myself by breathing. So there's benefit upon benefit upon benefit that comes from our really inhabiting our own breath fully. From the place where we left off around the 12th rib, I'm going to start just above that, and I call this ironing up the erectors, since so often people will feel a at the end of the day, like their back is kind of out of shape. And so what I want to do is just iron and smooth out the tension that can develop in the erectors and many of the other layers of fascia here in the back. I'm also going to be conscious of the movement of breath, and if I feel a place where there isn't sufficient breath movement, I might sink into it and allow the person to concentrate on letting go in that area. So here I am with the forearm near the elbow, just starting above the 12th rib, not too much pressure in the kidney area. Take out the looseness, take up the slack, indicating we're moving up in this direction, and then begin your movement with a curve, and largely the gentle curve here will be overall the feeling of going straight up, but also a feeling of that there's some curiosity and some variation in what I'm doing with my forearm here. Go slow enough that you can feel the breath or lack thereof. And then when I get to about the level of the inferior angle of the scapula, I want to take advantage of the possibility of opening the front of the shoulder girdle and also avoid the rubbing of the ulna bumping against the inferior angle. So I shift and put this hand underneath the shoulder, kind of opening up the front of the shoulder girdle, kind of cupping under the front of the humerus, and then with 3 fingers going between the scapula and the spinous processes, take out the looseness, take up the slack, and with compassion and accuracy through this area, just help the person let go of this common tension in the upper thorax and shoulder girdle. When you get up to here, it's nice to kind of pull through the trapezius, and you're maybe even affecting supraspinatus a little bit with your curved fingers. My underhand is opening up, so there's a gentle stretch of pectoralis major all the way to the sternum. So we're getting 3-dimensional opening of the shoulder girdle. This is a fulcrum which usually bears repetition. I'll usually do it 2 or 3 times. So take a look at this again. And you can always integrate that with some nice petrissage. The trapezius never objects. How we doing? Great. Just a few squeezes integrates what we've done through the arms, even if we're not going to focus in depth on the arms in the prone position. So, with working with levator scapula, you need to be certain where it's inserting, which is onto the superior angle of the scapula. And if you're not quite sure, different people have different levels of definition, follow up the medial border until it kind of turns the corner, and it's right after it turns the corner that you're going to find the insertion of levator scapula. If you need to, you can kind of pull the shoulder blade up, and it'll make it a little bit clearer as you pull the superior angle in toward your thumb. So once you're clear on your location, then you're going to be doing this fulcrum with the thumb right into the insertion, and your right hand is going to wrap around, kind of curving around the lateral border of the scapula, and pull up on the lateral border. So you go deeper, not by poking into the sensitive area, but by creating more looseness as your right hand pulls up on the lateral margin of the scapula. Then you can add a little bit of pressure, just leaning in with your body and allowing the person to relax this trigger point that is sensitive for just everyone. Hold it, hold it, hold it. Give them the opportunity to enjoy letting go from inside out in this somewhat tense place. When you feel like you've been there long enough, let go of your right hand, place the 2 thumbs together, and then just push down on the top of the scapula so you've got length in the neck so that you're stretching levator scapula. So I'm pushing it toward the person's elbow, and hold it. Hold it, hold it, hold it, so that they can feel length in the back of their neck, length through the levator scapula, and really experience a new set point through the neck and shoulder girdle. Too often they're used to the shoulder girdle being elevated, and here we're reminding the shoulder girdle can settle down and really be resting gently on the ribs. And clearly disengage. So we'll deal with the neck just as we dealt with the lower back, looking at three main layers, namely trapezius, semispinalis capitis, which is kind of like the cervical erectors, and then multifidus and rotatories. These are running transversely from transverse processes to spinous processes, somewhat higher. So first thing I'm going to do, I call it lifting the curtain, is take out the looseness in the side of the trapezius, and then just fairly gently you draw your thumb all the way to the spinous process. I do this at about 4 or 5 levels, and this kind of helps pull the head back on top of the body. So often it's in a forward head position, and it just opens up this territory for the deeper work we're going to do into the cervical erectors and the multifidi. So take out the looseness, take up the slack, just begin a nice, fairly gentle curve, effleurage at each of these levels. Then I'm going to come in and feel for semispinalis capitis, which is kind of an expansion of the cervical erectors. And I'm going to come in somewhat as we did with multifidus here. Starting at the level of T1 or so, just see what you feel with cross fiber or a little bit of circular friction to palpate, and then directly melt in with a direct pressure fulcrum where you find some tension. Take out the looseness, pressing in, so you're pressing on the tension. Pressing a bit more, so now you're in the tension. Now add just a little bit more of your own body weight, and you'll find that the person's being given a really good opportunity to, again, let go from inside out. Hold it, hold it, hold it, clearly disengage. At any point where you feel like you would wish to change your body position, use another hand, feel free to do so. I'm going to do this so that you can see using my left hand in each of these cases. So pressing into semispinalis capitis, now at a slightly higher vertebral level. Take out the looseness, take up the slack, melting in, hold it, hold it, hold it. And then coming up again, now at the level about C3, so a nice working breath, which tells me I'm on the right track. Take out the looseness, take up the slack, press in, press into the tension, let them let go from inside out. You relax, go to observing mind, and then disengage. And finally, one more point into semispinalis. Now the third main layer is multifidus and rotatories that's running across this way from transverse to spinous process. So to palpate here for tension, I would go from inferior to superior, starting between T1 and C7, see what I find. Commonly there's some tension there. I'll melt in, and in this case I'm melting in at a kind of 45-degree angle, whereas with semispinalis I was melting in directly medialward. Here I'm going anteromedial with the fulcrum. Then I come up another vertebral level, feel some tension there, melt in. Again, melting in is just a shorthand for saying do a direct pressure fulcrum. So I'm going to work at about minimum of 5 different levels here into the rotatories and multifidus. I regard them as the same layer. They're the transverso spinal group. Good. All right, later we'll introduce the half moon vector through the neck in a supine position, but it's fairly thorough for helping basic neck tension. it's important in the lower back and in the neck that we really have a clear visualization of the anatomy. We really know what we're doing, and we're not messing deeply around with something we're not sure about. So working with gluteus maximus, first thing I want to do is to really just melt the general tension that accumulates here, and just pressing in with my, not the elbow, but with the forearm near the elbow, into the apex of gluteus maximus, into its thickest spot. Just take out the looseness, pressing directly down. Take up the slack, just relaxing your legs and sinking in a bit further. Allow the person some time in which you're just going to hold and let them relax from inside out. Hold it, hold it, hold it. You may even observe their breathing pattern or feel the breath movement through the lower back and pelvis. And then when you're ready, clearly disengage. Now we want to add the feeling of length to this fulcrum, since most people don't experience that the gluteus maximus is really a nice long muscle. And so how great it feels to just make contact here, just lateral to the SI, just underneath the iliac crest with the loose fist. Take out the looseness, take up the slack, and then begin sweeping through. Remember, this inserts into gluteal tuberosity, even into the iliotibial band, so it's one of the longer muscles in the body, and you can help them feel that coming down, and then clearly disengaging about 3/4 of the way down into the IT band. Start one fist with more lateral with the second pass, because this is a pretty broad origin. Take out the looseness, take up the slack, and add length. I could even feel her lower back lengthening, so notice how you can create a feeling of unity through the whole body, not that the person is an upper half and a lower half. What can add to that with the third pass, so it's kind of one fist with more lateral, I'm almost going to go over the greater trochanter here, is to switch hands. Let this hand be straight with the heel of the hand against the top of the sacrum. Your fingers are lifted up away from the pelvis. So traction the spine into length, and on top of that, add the traction down through the gluteus maximus. You're also affecting medius a bit here as well with this third pass. Nice breath through the whole lower back. You can know that makes a good difference. Good. Put your draping over gluteus maximus, and now you're going to focus in on the hamstrings. Focusing on the hamstrings, I want to just bring circulation and greater length into them. I'm going to let the back of my hand nestle into the ischial tuberosity. Take out the looseness, pressing straight down. Take up the slack, pulling down toward the lower leg, and then begin a nice, slow, moving fulcrum through biceps femoris. Again, get your movement by relaxing into gravity and relaxing your legs. And then change the angle, come up to the attachment on the fibula. I like to work with the ridge of knuckles here, right between the hamstrings, helping there be more fascial freedom between biceps femoris and semimembranosus tendinosus. So go right down the middle, again starting at the ischial tuberosity, and as you get into the back of the knee, ease up a little bit. That's engagement site, so you can make the movement, but not with a lot of depth. Finally, we're going to go down semimembranosus and tendinosus, again nestling into the ischial tuberosity as we do in each one. Take out the looseness, take up the slack, and then do your moving fulcrum through the semis. And you're going to end up coming up to the back of the tibia. If you like, you can even let the leg down. Feel the length. At any point, rocking, petrissage, a little effleurage will introduce a feeling of wholeness to the whole body remember, as we do deep massage, you don't want them to feel like they're a series of liberated parts, but they're a connected, relaxed, and satisfied whole person. So, working with the lower leg, you can take the forearm here, the concavity of the ulna here, matching the convexity of the gastroc and soleus. Take out the looseness, pressing toward the table. Take up the slack, pulling down, and then begin a nice, slow moving fulcrum through the gastroc and the soleus. And when you get to the Achilles tendon, slow down. Fascia here has less circulation than the muscle belly, and so it changes a bit more slowly. Therefore, it really rewards you slowing down, allowing the tendon to change, allowing length to develop through the whole muscle. And when you get onto the back of the calcaneus, your traction actually affects the whole body. And so slow way down, knowing that you're engaging the whole self through the bottom of the foot. And integrate. Okay. All right. Now we're going to begin the work on the front of the body. One of the first things we're going to do is check in with the person, since they've had quite a bit of experience lying face down. I want to get a baseline of how it's going. So I want to ask you, Julie, how's it going so far? Any comments?
Very well.
Okay, terrific. I'm also listening to her voice vitality when we look at working signs. How does her voice sound? Did it sound convincing? Did her answer follow my question quite quickly? Did it just feel believable? And I did. So I'm happy that it's going well. I trust what she said, and I know we're on the right track. Now, you'll notice I've taken the bolster out. Unless the person needs a bolster for lower back issues, I prefer to work without it, because some of the things we're going to do require being able to traction the body into the full length, and if that length is kind of broken up with the bolster, it may not be as effective, particularly for this basic fulcrum, which is very global, which we call the half-moon vector through the legs. Now I'm going to be just patting this down so that as I pull on the legs, the person has no fear that they're being exposed. I think that's just goes without saying, but I just want to mention it. And the half-moon vector through the legs is the first explicit fulcrum we're doing, which we call a field fulcrum, which means I'm going to want to be addressing her whole body with this fulcrum rather than kind of focusing my interface on a certain place. Because similar a little bit to what we just did with the calcaneus and the Achilles tendon, I want to see this engagement through her whole body and amplify it. And the way I'm going to do that is just nestle in, that is, taking out all the looseness between the calcaneus and the Achilles tendon and my fingers and palm. No pressure, just let the person's weight rest in your fingers and palm. And then do a straight pull through the body, so you've taken out the looseness, really taken up the slack in the body, and then introduce the curve, and the curve is quite subtle, where you're just pulling on the Achilles tendon so that you're dorsiflexing the feet a little bit, and they may be raised up a tiny bit. Lifting the feet off the table has nothing particularly to do with this fulcrum. The only reason I might do it higher would be if I felt like it was challenging my back, so it would be for body mechanics' sake. But the lower you have the legs, the more likely you are to engage the whole of the person. So this is called a half-moon vector through the legs. Hold it, hold it, hold it. Give the person a chance to let go from head to toe, and they may unconsciously become aware of places where they're holding, so it's giving them information about both freedom and restriction. Then, continuing to gently pull, set the legs down in length, and make a little closing gesture, clearly disengaging. Give them a minute, and then we're going to go up to the side of the pelvis. So we're going to want to address this area of the side of the pelvis, again, often doesn't get quite enough attention, tensor fascia lata, and then lying here, gluteus medius, deep to it, almost as if it were a deeper layer of gluteus medius, gluteus minimus, all of them attaching to the top of the greater trochanter. So I'm going to just work into 9 areas. Here, tensor fascia lata. Here, right along the gallbladder meridian, from the iliac crest to halfway between it and the greater trochanter, and then just onto the top of the greater trochanter, and then starting a little further back, a little more into the posterior aspect of gluteus medius, again coming toward the greater trochanter. So it's like 3 lines I'm following, each with 3 points. The third of each point is going to be the same one, just over the greater trochanter. So notice that I'm kneeling, or you may be sitting in a chair or stool. I would not recommend doing this standing up and coming at it obliquely. In deep massage, we want to find the way where gravity is the therapist, and you are finding the body position that allows you to use the least amount of effort for yourself. My fingers can rest on the lower abdomen, and so in addition to doing direct pressure fulcrum with my left thumb, I'm also doing a kind of medial rotation, holding the leg in medial rotation while I press in, and then letting it come back, repositioning here halfway between the ilium, back the ASIS, and the greater trochanter here. That's the second point. And if you like, you can introduce a little bit of rocking. It's up to you. The main thing is make sure when you medially rotate that you engage the end range so they feel like their hip is really engaged. The hip is used to lots of force, so you need to use enough pressure that you're speaking its language, but of course not too much pressure. Those are the 3 middle lines. So it's 1, 2, 3, 4, 5, 6, 7, 8, 9. And those last 3 points, she was a bit looser, so I didn't need to spend quite as much time there, which is great. Okay. Clearly disengaging. It's natural to take that into the iliotibial band. This we sometimes call making rainbows, because we sort of use this shape. And I'm right under the greater trochanter, kind of starting where we left off. And I'm going to take out the looseness posterior to the iliotibial band. Lift up, taking up the slack, and then just hold that. Hold it, hold it, hold it. The person usually can feel a kind of disengagement of the iliotibial band from the vastus lateralis. And allow enough time for that feeling of freedom to develop through the lateral leg and through the thigh as a whole. This fascia goes all the way into the femur. Notice how you're not only manipulating the space in the body, you're really manipulating the person's sense of time. So if I rest in and hold, oftentimes the person will sink into and experience a feeling like they're in eternity, where they're not on clock time anymore. They're on just totally relaxed time. Some people talk about chronos versus sacred time. So we're kind of moving into that experience of eternity whenever we hold. And I just thought I'd mention that here. Now, as we work down the hamstring, so we can work down rectus femoris, starting at the front of the hip joint, again creating that feeling of opening through the pelvis and the hip by sinking in, take out the looseness in the front of the hip joint, take up the slack, pulling down just gently, giving the body an indication of what direction you're going to go in. So now you're at the proprioceptive boundary. And then begin your movement through rectus femoris. Again, introducing a gentle curve as you do so, creating that feeling of length. I'm still thinking about the front of the hip, course, my interface, my mind's eye, is right where we're working. And since some people are a little anxious about their knees, oftentimes I'll put my hand over the knee, just kind of reassuring them that's a boundary I'm going to respect. And then, because there can be some tension in this patellar ligament tendons, I'm going to be doing just a little bit of a fulcrum here. With both thumbs, press in, take out the looseness above the knee, pull them gently apart, take up the slack, and then add the additional movement that's mostly coming straight out, just a little bit down. And that feels so good, oftentimes surprisingly so to the client. A lot of times I'll do that twice here, both above and then below the knee, in between the patella and the tibial tuberosity. Take out the looseness, take up the slack. Again, your movement is kind of like making a smile with your thumbs. Good. Now coming into, again, the gallbladder meridian area, the peroneus longus, alias fibularis longus. I'm going to do the same kind of making rainbows thing that we did with the iliotibial band. So I want to get down enough that it's easy for me to lift up with my thumbs. So I'm going to come in behind the fibula, press in toward the middle of the leg, then press up toward the ceiling, lifting up peroneus longus. Person can start developing a sense that their legs are very light. There's energy flowing through their legs. They're not just things happening there, but they're really places that can feel wonderful and cared for, as every place in the body deserves. In some of these I'm holding longer, some shorter, depending on the amount of tension we find. And you'll notice that I look up to her face and to her hands, just seeing the movement of breath, seeing the sense of calm that she's exhibiting. And then I want to address, as we did this front line through the rectus femoris and tibialis anterior, take out the looseness with a loose fist, take up the slack, pulling down toward the leg, toward the foot, and then overall down while adding a gentle curve. And again, this curve is not just for the sake of a curve, it's also because I get more information when I don't just go in a straight line. More information about more areas of the muscle, about how it moves or doesn't move. When I get to the front of the ankle, I continue but ease up a little bit. It gets a little more tendinous here, of course, and I will, with very gentle, almost like a nerve stroke, go to the insertion, the medial longitudinal arch. Okay. Feel free again to restore a sense of wholeness with the nice effleurage. Even if there's very little pressure, and in this case no lubricant, you can still create that feeling. And then it's amazing what a couple of nice little squeezes of the foot can do in terms of adding a feeling of completeness to the work with the legs. All right, so we're about to work more with the front torso, the arms, the neck and the head. And of course, this is oftentimes felt as a more personal area in the body. Feelings around the abdomen, around the heart, the throat. It's all quite tender and fascinating. And so I want to work with respect in this area. And I'd like to illustrate how the techniques show us something about what I call the 7 dimensions of touch. I've been applying this model through everything we've done already. It's just embodied in my work. But I'll be mentioning each one of the 7 dimensions of touch at various points during the demo here. The first dimension of touch, which you've seen obviously in great detail, is just contact. When we first take out the looseness, we're creating contact. When we place a resting stroke to integrate, just as I might on the, just at the, below the navel and the head, or at the sacrum and the occiput, all of these are just ways to first establish contact. The next thing that happens after you've contacted the body is you begin to move. We've kind of embodied those in the steps of take out the looseness, take up the slack. So movement is the second dimension of touch. And the third dimension, which we're going to be starting working with very explicitly here in her body, is the movement of breath. How breath creates literally the experience of three-dimensionality. In me as a therapist, I experience my body more three-dimensionally when I'm breathing fully, so will she. And this is critical for the work with the abdomen, of course. I'm going to begin work with rectus abdominis at the level traditionally regarded as that of the hara or tantian in Asian medicine. So I'm starting in the thickest part of the muscle belly of rectus abdominis because that's most comfortable. You don't want to work right in the center on the linea alba, and working on the lateral margin really won't address the rectus abdominis itself. So I want to press in. Now note that this area has mostly flattened muscle sheets. So if you're working at it, coming at it from a vertical direction, you're really not speaking the language of the abdomen, which is horizontally organized. So I like to keep this lower hand horizontal, fully in contact with the lower abdomen. My middle finger is going to be my main working finger, but the actual motive force is going to come from my right hand and also come from just relaxing my knees. So you're not pressing in, you're just sinking in, allowing the person to let go from inside out. So here I have this hand flat, this hand on top of it precisely, taking out the looseness with direct pressure. Take out the slack, take a breath yourself, you therapist. Relax yourself and then relax your knees and just sink into it a little bit. It should be comfortable. And don't hesitate to check in and see that it is. So how's that for depth, Julie? Good. Great. Remember, it's such a tender area. It's important that the person be able to enjoy the letting go in this area, or at least feel neutral about it. Afterwards, it'll always feel good. So I just take areas here about 1 inch to 1.5 inches apart, melting in, relaxing my own breath and legs, sinking in. On this left side, commonly you'll feel the aorta pulsing. If a client doesn't know what that is, they sometimes can wonder. I reassure them, I say, oh, you've got a nice strong pulse. Then they smile and they feel complimented, so it's good. Don't try to get into a tug of war with the aorta. Let it win. Let yourself be bounced up and down. That's perfectly fine. Don't press too hard here. Again, this is a good place to talk about pressure and deep massage. Remember, we're not doing deep tissue. We are not trying to change the tissue consistency through pressure. We're primarily trying to make enough contact with the body that the person feels the opportunity to let go from inside out. So take out the looseness, take up the slack, relax, sink in, and allow them the experience of deeply relaxing into this part of themselves. And of course, that can go global, and they may experience relaxation everywhere. Now, as you get in right underneath the rib cage, it helps to create additional looseness. This can be a bit of a taut band here, so I like to take the ring-in little fingers, kind of pull the rib cage down, and then work up with my hand just a little bit beneath the rib cage. So I'm still into the tendon of rectus abdominis, but adding a little additional looseness. Notice my hands are almost at right angles to each other. My left hand is pointing up toward her left shoulder. Hold it, hold it, hold it. So this is the first place where we're adding the vector of up toward the head. In all of these, we're just working in posteriorly toward the back. Here, we're beginning to do the next important step, which is really lifting the rib cage, in this case from directly below, Then I bring the arm up. I'm going to let this hand with my fingers naturally spread be against the side of the rib cage and let this hand work up just the right side of the sternum. And my ring finger's about at the middle level, middle fingers kind of where the costal cartilages meet the ribs, and then the first finger is between the costal cartilages in the intercostal space. So with both hands, I've changed my position here. I'm further down the body in more of a lunge position. This hand pressing in, this hand pressing down. I take out the looseness, and then I take up the slack with both hands. I'm pushing up toward the head, so we're creating some length. It's as if the waist is being given an opportunity to have more room. And then I'm going to work with my left hand, my primary interface, lengthening the tendons rectus abdominis on the sternum and the costal cartilages. And I'll come up not very far so that my hands are never between the breasts. I have the fingers about here at the level of the fifth rib, which is as high as rectus abdominis goes, but it interdigitates with pectoralis major here. And so I like to touch my middle fingers, pull up with my right hand for about 2 or 3 ribs worth of space, and then reposition with the left for the last 3 ribs, and work all the way up to the clavicle. This is the very end of the kidney meridian, place translated as elegant mansion, which I enjoy that imagery. This hand can open up the front of the shoulder girdle a little bit as you do that. The fourth dimension of touch I describe as graceful verticality. And of course, first of all, this means healthy body mechanics, but all energetic systems describe energy as flowing between heaven and earth. So when our touch and our body is aligned with both gravity and grace, our touch will be energetically much more effective. And fifth dimension of touch I consider to be heart. Obviously, do we care? Does the person feel the palpable presence of care in our touch? So I need to make sure that my heartfelt feelings somehow or other are manifest through the quality of movement and the quality of attention and energy in my hand. Particularly, obviously, this area of pectoralis major calls for an appreciation of the heart, calls for an appreciation of the way in which pectoralis major expresses our wingspan and also affects the arms and how the arms and the hands are expressors of the heart. So this whole heart element makes massage partly a wonderful, caring healthcare skill that it is. So to work with opening the heart, pectoralis major area, what you want to do is take the loose fist and connect fairly gently with the sternum, taking out the looseness. Your fingers pointing this way. Take up the slack, pulling toward yourself, kind of creating a feeling of opening already. And then create a moving fulcrum, just with your, primarily the knuckles here are moving, stretching the pec major and its fascia, opening the heart. And when you get to the space between the rib cage and the humerus, clearly disengage. Take the opportunity to work with both fists across not only pec major, but also its relationship to the whole of the deltoid muscle. Let the knuckles right here start just in front of the deltoid, so that when you take up the slack, you pull back toward yourself, you'll see the medial rotation is leaving the arm. Lateral rotation is really taking place. And you're coming across the whole of the deltoid deep to it, pec major, and ease up. Let's see if you can get all the way to the table, going as much as you can around the deltoid. Good. How's that?
Oh, that was great.
Okay, good. All right. Continuing opening the shoulder girdle through the arms, as we worked with the hamstrings and quadriceps, similarly we work with biceps brachii, triceps brachii. Just let the loose fist start beneath, just alongside the armpit, and not too much pressure at first. This is sensitive around the biceps tendon, but take out the looseness, take up the slack, and then begin a nice lengthening of biceps brachii. As you do so, you can let the arm down if you like. You're going to end at the radial tuberosity, so go a little ways down the radius. Hold it, hold it, hold it. Clearly disengage. You can use a pillow. A lot of times I'll just use my leg here to work with the triceps. And I'm going to have this hand underneath the arm so I can easily add a little bit of traction with my left hand. With my right, just coming to where the triceps originates on the scapula. Take out the looseness, pressing in toward the head. Take up the slack, pulling up toward the elbow, and then with both hands add length. Give the person a nice sense of length through the whole triceps brachii. And as you get close to the tendon and the olecranon, just slow down a little bit and feel the length through the whole muscle, and then clearly disengage. And here I like to really come back to the trapezius and do a series of soft tissue fulcrums, each one of which is bilateral, and each one of which is a little more lateral than the last. Trapezius, you know, is a treasure trove, and so working, giving it its fair share of time is really essential and a real pleasure. I'm going to work into 4 areas, and I'm going to work on them bilaterally. This is all about wings, and so I want the person to feel a nice sense of wingspan. So I'm going to press in just alongside the neck here into the belly of the trapezius. Take out the looseness, just leaning in with your body weight, take up the slack, and then let the person do with that what they will, breathing, and perhaps they will let go more. It's common. And then you'll sink in more and more deeply. And I say here, it's like sinking back in time, not only in space, because the trapezius, like all muscles, but the trapezius seems to especially record the accumulation of tension over the years. So clearly disengage, come out about an inch, re-engage, take up the looseness, take up the slack, pressing in, hold it, hold it, hold it. Give them some time in which to let go. And when you're ready, clearly disengage. You may find more tension on one side than the other. Nonetheless, try to stay at interfaces with both sides so that they really feel that bilaterality, even if you may be emphasizing the place where there's a little bit more tension. Now working with the scalenes and the posterior neck here, it's nice to just sweep one's hands horizontally around. I'm going to do 3 sweeps, one at the level of C7, one at the level of C3, and one at the level of C1. To help with this, it helps to do like an active movement therapy with this, with the person bringing their chin up and then looking to the opposite side as my hand sweeps around. I'm going to end up all the way at the spinous processes. So I call this scalenes, but it's really affecting the scalenes, posterior neck. And so I'm going to start right here above the clavicle. I'm going to use SCM, sternocleidomastoid, as my starting point in each case. Lifting your chin up, Julia, and moving to the left. I'm going to draw my fingers around. If this were too challenging for your hand, I could stand up and place one hand on top of the other. Normally I don't need to do that. Coming up, second pass at the level kind of the Adam's apple, about C4 or 3. Go all the way around. This hand can rest on the shoulder just as a kind of mother hand, as they say in shiatsu. And then coming on back, let your chin come down. Third pass is at the level of the lower jaw, starting at the SCM, lifting up, and coming all the way around. My middle finger is going to be passing just posterior to C1. So I'm helping those suboccipital tissues, also just gently lifting the occiput up here too. And coming on back. When we're working with the head and the face, it certainly is a fantastic opportunity to appreciate what I call the 6th and the 7th dimensions of touch, also in ourselves. First of all, for me as a therapist, I need to work with understanding. I need to not only care about the person, I need to do my best to understand the person. That means taking a history, it means letting this person impact me in such a way that I have an energetic intuition, as well as kind of a structural description of what's occurred to them, what they desire from this session. So understanding is critical. So when I'm working in this realm, I'm also conscious that I'm working in a realm near the brain, near the central nervous system. The face is the most expressive part of the person. And so as I do this, I'm thinking kind of deeply about the periosteum, not just the superficial fascia. So I'm going to press in with my thumbs, just right at the midline, hold them gently apart, and then do a moving fulcrum through the forehead. Again, feel the shapes of the frontal bone as you move across. Imagine that you're stretching the periosteum, not so much the facial muscles or fascia as the fascia on the bone. Think of it as if the deepest tension goes into the bone and can be manifest through the periosteum. So it's a great boon to the person to let go on this level. Now, some clients may not like much pressure on their face. Feel free to change what you need to in order to satisfy your client. But if this is good for them, it's probably something they've never had, work that works deeply on the face. And one of the Japanese koans is, what was your face before you were born? And I almost imagine that's what we're arriving at as we get at these deeper facial tensions here, where the person gets a restored sense of neutrality, innocence, just like the face of a sleeping child or baby. So I'm working in a series of passes, each one of which is just a little bit lower than the last. Take out the looseness, take up the slack, moving fulcrum, come over the ear, ease up over the temple, it's a sensitive area, and I kind of do a nerve stroke behind the ear and back up so that each time they feel a kind of a little bit of a facelift. And come across the upper jaw. Notice when you start engaging the masseter and addressing temporomandibular tension that we commonly have, helping that let go. Working beneath on the lower jaw and again through the masseter. In the front of the lower mandible, again a nice moving fulcrum, and finally underneath the mandible, take out the looseness, take out the slack, slide, helping the fascia here along the mandible loosen up, relax, help the person relax their jaw, their tongue, etc. And coming again up behind the ear. Now, building on that facial balance, let's add some cranial fulcrums. These are going to be little half-moon vectors that I'm going to introduce over the ear and then more just lateral to the midline. So it's going to be 2 passes, and to just show them more slowly, I'm coming in just above the mastoid process, take out the looseness, and then make kind of a half circle or a full circle. Again, my focus here, as on the face, is more on the periosteum than on the superficial tissues. So let it be firm, not painful, but firm pressure. introducing flexibility. You notice, at least in the first pass, I commonly will have her forehead against my forearm, so it's feeling very secure. Then I come closer to just lateral to the midline, and I'll do generally about 6 or more. Again, half moon vector, little semicircles with my fingers. It's almost like in Kung Fu with crane's beak, they call it. And then working, again, just lateral to the midline, all the way until you get to the hairline. So first pass in the area of the gallbladder meridian, second pass more along the line of the bladder meridian. As we then work here into the cranium, say it's a nice time to mention the idea of alchemy. One of the things we're looking for with sessions is for the person to get the optimum time and space in which to re-encounter themselves. Every massage is like an awakening. It kind of just points to a person, look at the tension here, see how you can let go of it. As we did a field fulcrum, half moon vector through the legs, now we're going to do a similar field fulcrum here using the occiput as our area from which we're going to engage the whole self. I'm going to have my fingers underneath the occiput like this, finding the bone-to-bone connection, and then just bringing my fingers a little bit more toward me. That's going to add length to the neck, and it's also going to nod the chin down just a little bit. You don't have to lift the head up at all. Don't do that efforting. Let the head continue to rest. Just bring the fingers a little closer to you. Again, the half moon vector through the neck, like through the legs, is aimed at the whole energy field. So my interface is kind of more consciously, I'm thinking about the whole person than I'm thinking about where my fingers are at the occiput. This isn't the fulcrum into the occiput. Okay. So, taking out the looseness between my fingers and the occiput, lean back, I'm taking up the slack through the spine, and bring your fingers toward yourself, adding length and just the least bit of flexion of the head on the neck. Hold it, hold it, hold it. And when you're ready, if you see a working sign or if your gut just tells you that's long enough, continue to gently pull, set the head down in length. You can make a few little half moons similar to what we did, but two-handedly here on the cranium. And then in a session, I would normally ask the person just before we complete it, is there anything more you'd like in order to feel real complete with this session?
This is great.
Okay, terrific. Now I'll integrate this on the opposite end with a half moon through the legs. Take out the looseness between your hand and the calcaneus and the Achilles tendon. One foot behind the other. Straight pull through the whole body. Now you're in position. Now put in the half moon, adding just the least bit of dorsiflexion through the ankle and a little bit of additional length. Hold it, hold it, hold it. Give the person a chance to just really feel the session summing up from head to toe, through their whole length, through their whole being. And then continue to gently pull, set the legs down in length. And for the closing half moon, you may want to do an extra squeeze at the calcanei, or you might want to place the thumbs on the bottom of the foot, fingers here. This is just a resting stroke. This isn't any pressure. Just allow them to feel nice and contained with this closing gesture. And then make something that is a closing gesture for them. And let them know the session's over. You can stay in order to just touch base with them briefly before you leave the room. And they're in a very relaxed, often altered state, so you may want to check in with them before you leave the room. Leave the room, come back, have a brief discussion, and closing gesture, hug, handshake, whatever seems appropriate.